Good afternoon. The Mahoney Matters team welcomes you to today's panel, After the Storm, the Valley Emerges from the Pandemic. I'm your host, editor Mark Sweetwood, and we thank you for joining us. Today, we're going to discuss the next steps after the COVID-19 pandemic disrupted all of our lives for the last 14 months. And there are many questions, especially those facing our business community. How will business and entertainment emerge? What will the new normals be? What are the keys to thriving in the coming months? So today, let's get some answers. Joining us in today's virtual event, which is sponsored by our friends at Tema Roofing Services, are Sardar Dede, owner of Cafe 422.
Thank you.
Eric Ryan, he's president of JAC Management.
Hello.
Missy Russo, she is chief operating officer for Mercy Health Physicians.
Hello.
And Guy Coviello, president and CEO of the Youngstown Warren Regional Chamber. Welcome to everyone. I'm glad you're all here. We also have a great team working behind the scenes to make this event possible, including McClatchy's events operations manager, Connie Heiberg, and video producer, Beth Welsh, as well as the Mahoney Matters team, senior editor, Eric Nelson, content manager, Jeremy Harper, reporters, Justin Dennis, Jess Harden, Ellen Wagner. They're all behind the scenes making sure this happens and also covering the news of the day. If the audience, anyone out there would like to ask us a question during today's discussion, please go ahead and just leave us a comment on the Mahoney Matters Facebook page and the YouTube pages. And we'll be monitoring them. And we ask if your question is for a specific panelist, would you let us know? And we'll break into the discussion and direct those to them. You can also watch the full recording of today's discussion later on Mahoney Matters Facebook and YouTube pages. And of course, we'll have full coverage tomorrow morning on MahoneyMatters.com. Today's community discussion is part of Mahoney Matters' ongoing commitment to bring people together to talk about the issues that are very vital and important to the Valley. If you like what you see and if you like the quality journalism that Mahoney Matters team delivers every day at MahoneyMatters.com, feel free to hit us up for a monthly or even a one-time donation. We appreciate all of your support. And you can go to MahoneyMatters.com and find those links. I thought today, if we're going to dive right into this, I'd like to discuss what the past 14 months have been to a specific industry. One of the hardest hit segments, arguably, has been the restaurant industry. And Sardar has restaurants in Warren and Boardman. And Sardar, first, thank you for joining us. And I think the big question we want to start with to kind of set the table here a little bit is what has the past 14 months been like for you at Cafe 422?
Thank you very much. Good afternoon, everybody. Well, 14 months is just seems like everybody else, being a small business owner in this valley. It's been really hard, especially when the federal government or state, they shut our restaurants down, our businesses down. It was very hard to keep our restaurants going, and at the same time, some of our employees, they wanted to work, so we couldn't find hours for them at the same time. But as things get a little better towards a month or two pass by, and then they start opening our restaurants for carry out first, and then for outdoor dining, and slowly open up our restaurants for 50% for dining also too. Right. So all that one slowly start going back to a normal little by little, but it definitely was restaurants business was slowed down big time. We couldn't bring all our people back, even they wanted to bring it back. Unfortunately, some of our employees didn't want to come back because of the COVID. Right. So it was a little hectic at the beginning. But
and it's hard on your customers as well.
It's true, because people are putting lots of pressure for the carryouts, certain amount of time, and we want to do the best we can to accommodate our guests. And especially, I think it was very hard for me because you couldn't expect to somebody just come in and shut down your restaurant business or your business. Doesn't matter what business you're in, and so it was hard. You still have the bills to pay. You still have responsibilities. You still have people that have been working for you for days, for years and years. So you look back and there's a lot going through from your mind, and but there's nothing very much you can do until everything kind of settled down for a little bit. But we did lots of carryouts. we did 2 weeks. We took 2 weeks time and served our community, that people that serving at first responders, from our nurses, for our doctors, for our office departments, police departments, all of them. We serve for 2 weeks complimentary lunches on them. So
Wow.
that will keep us busy, between my brother and I. And we tried to come up with something positive, and that's what we did during that slow time, during the time that we want to do something for our community. So we did. And after that, things I get a little bit normal, but it's a challenge. Big challenges with unemployment, or federal government or states are giving the money away to people that are not working, which is fine, totally fine, it's understandable. I mean, if the people that needs help, we all for it. But at the same time, when jobs are out there, it's hard to bring people back here and come back to work. So that's our big challenge. And during this pandemic,
did you learn anything that you, in the last 14 months, that you might continue on in your business? There's something, that you'll use going forward? Any innovation?
Yeah, sometimes the downtimes are not the bad time, but when you don't know how long it's going to take.
Yeah.
What we did, I have been planning with my brother to renovate our restaurants, our bathrooms, especially Cafe 422 Warren, because we've been in the business since 1939.
Right.
There's some things we did over the years and years, but sometimes things takes time, and it might take to the next level, because you have to shut down your restaurants to do the specific renovations, like the restrooms, like the whole main diner room, moving the walls around. So I look back, and that's a positive thing that I can tell you about. So we did renovate our restaurants here at Cafe 422, and during that slow time and downtime too.
Well, and it was always, my wife and I like the one in Boardman. It's always been a nice place. So we have not been to see your renovations yet. So
thank you. We'd love to see you all here for lunch.
We'll have to get over there and see it. Thank you, Sardar. Probably the other hard-hit industry outside of restaurants has been the entertainment and arena industry. And Eric Ryan at JAC is in charge of booking acts. Get this, for most of the major venues: Cavelli Center, the Youngstown Foundation Amphitheater, Packard Music Hall, and even the Campfield Fair. Eric, everyone wants to see entertainment again. We need it. How has your organization made it thus far, and how do you manage that pressure to reopen the larger events, but do so as safely as possible?
Well, thank you, and I appreciate you having me. Yeah, I wish I had all the answers. How have we made it? I really have no idea. In a lot of sense. I mean, we've been out of business now for 14 months, and like our friends, not like our friends in the in the restaurant food industry, we don't have a takeout. It's been tough on so many industries. There's no doubt about it. But arts and entertainment has been the number one unemployed sector in the state of Ohio. We were a $41 billion industry prior to the pandemic.
Wow.
Over 300,000 employees worked in arts and entertainment, and as of late February, we were still over 30% unemployment. I could tell you, in the venues that we run, we're over 60% unemployment still. Just in the fact that the state has eased up some of the restrictions, but I can tell you we can't get into business at 25%. We won't be doing shows at the Cavelli Center, anything of substance, at 25%. It's just not economically possible. So, it's been very difficult, quite honestly, from the sense that, we have pushed. I'm on the Ohio Citizens for the Arts, and we've been pushing for information. We need information, and we've continued to book events and push them back and push them back and push them back. Well, quite honestly, other states that we do business in are completely open. Texas and Florida, and there's other ones, that are open. We think we can open safely. We don't think that 25% is the number, but where is that number, kind of thing. So, it's been very, very difficult, and especially on the fact that, we have a lot of team members and, employees of ours that, that need to get back to work, and we just need the ability to do so.
What is in the experience of the past 14 months, Eric? What has surprised you the most?
You never visualize, and you could never imagine that you could be forced to be out of business. That's surprising. I don't know who that wouldn't surprise, that that you weren't allowed to be in business for 7 months, and then based upon even the restrictions now, in April, the administration came out with some new guidelines. They lifted some things which we were appreciative of, but the fact that just to be forced to be out of business, and I understand. I mean, we're in a mass gathering business. It's during a pandemic. I don't know that you would ever be prepared for that, I should say.
I promised the panel that I wouldn't put anyone on the spot, but I'm going to break that promise with Eric right now, because the Canfield Fair. I remember I mentioned this earlier. Everyone is asking about grandstand events. We probably get more questions, texts, what have you, at Mahoney Matters about that issue than almost any single reopening issue that we get. The governor says we can return to normal after our statewide caseload drops to 50 cases per 100,000 people over 2 weeks. When does that need to happen to allow you to book a big act for the Canfield Fair? And do you have a drop dead date that someone you may book for this won't be available after X date?
Yeah, so actually, as it relates to the Canfield Fair, we have our entertainment booked. We have it confirmed and booked, where typically by now we would be announced and on sale. But the issue is that we do not want to announce it until we know whether we can have the event or not. I sort of think that's irresponsible to announce a show or to announce an event that you're not even positive legally whether you can do it or not. So, we need enough time to be able to sell tickets, and typically that's 6 to 8 weeks from the event. Canfield Fair is Labor Day weekend, so we would be talking, we would need to know by first week of July or so, and so we can get it out there. The one thing that we're trying to do is go out there and say, hey, give us a date, give us something to work for. Now we know things could change, and I guess he did do that with the 50 per every 100,000 people, but truly, we're in the event planning business. It takes a little bit of time to event. So the answer to your question would be 6 to 8 weeks out from the event. 6 weeks would kind of be the drop dead date. Right.
Okay. Well, that's a good thing to put on the calendar and kind of watch. And I'm sorry, the name of the big act was.
I wish.
Well, I tried, America. They're in two, really respected business folks. You see sort of what the last, 14 months looks like. And now you're starting to see the look at the, what's the next phase going to be? How can we, go forward? What will the restaurant industry look like? What will the entertainment industry look like? And I thought, and we're really kind of blessed to have a guy with us today, but I really kind of want to look at some of the strategies going forward and what the future could look like. Recently, the Youngstown-Warren Regional Chamber joined with the Mahoney County Public Health District and the Trumbull County Combined Health District to encourage employers and their employees and families to get vaccinated against COVID-19. So I thank Guy for joining us today. And I have to imagine, Guy, that the news release with that sort of public stance has maybe a purpose beyond just getting more people vaccinated. How does the chamber see the role of vaccines with the reemergence of businesses right now?
Mark, I don't think it's just vaccines. I think it's an overall best practices to stay safe, because the way we look at it is the sooner that our businesses can reopen and the sooner that they can we can be comfortable that they're going to stay open, the better for everybody. So whatever it takes to get to that point, that's where we want to be. And that's regardless of how you feel politically about vaccinations or no vaccinations. We just want our businesses to be open, fully open, and stay open.
I was just in Florida, where they're seeing some of the vaccine hesitancy that we're sort of experiencing right now here. Guy, does the chamber plan to help connect the dots in the community between vaccination and a sense of normalcy?
We will continue to cooperate with the two counties here to make sure that they're getting what they need to get the communication out to the businesses. What we have found is a lot of good communication comes from employers to employees. And we've also found that constant reminder of when they go home from work, because the workplaces themselves have proven to be pretty safe. But it's when people go home and get social that sometimes it hasn't worked out so well. So we just wanted our employers to support reminding their employees about good practices. We joined several months ago the Ohio Business, the Stop the Spread Coalition. It's a group of businesses all across Ohio, and so the sooner we stop the spread, the sooner we get rid of this thing, the faster our businesses can go back to normalcy, or what's going to be the new normal.
One question might be, if this was maybe any other community guy, is what is the one thing that will assure Valley businesses returns, to pre-2020 levels? But there's long been a sense here that we're still facing hardships from the Rust Belt era. That is there a fear on the chamber or on any of the businesses that are members of the chamber that we may have lost even more ground in the COVID era? And if so, what can we do about it?
Mark, I might say that I'm going to take the opposite position, and I don't want to sound insensitive to the businesses, especially those on the panel here that have suffered greatly and will continue to have a hard time. But if you look at the stimulus, the payments and all that, we probably benefited more than other communities because our average payroll, our average annual salaries are such that pretty much everybody in the valley got a stimulus payment, and that can't be said for other communities. And that generated more money in the community to spend on companies. So that I don't know that coming into it limping because of the past hurt us. If anything, it might have helped us.
So when businesses are talking to you about about reemerging, what is the chief concern that you hear?
We are very focused on protecting businesses as they reemerge. So and we took this stance from the very beginning. As we started to reemerge and go back to work, we immediately worked with the state legislature to put in some tort reform to protect businesses from COVID-related lawsuits, to make sure that their employees and their customers who contracted COVID couldn't just automatically drag them into a lawsuit saying, well, we got it at your place of business, we're going to sue you. We continue to work on public policies that are going to help businesses as they reemerge. One of the issues that has come up is around remote work and where employees get taxed.
Right.
And we don't want the burden of tracking where those employees are conducting their business to fall on the employers. It would just become a nightmare from a regulatory standpoint if you had to track, is your employee working at home and in what town is that, or is your employee working at Panera and what town is that? So we're working on some language right now in the legislature to try to make sure that burden of tracking where your employee is working for tax purposes does not fall on the employer.
Well, what kind of impact would that have on the city of Youngstown?
All the cities are going to face a really difficult, I don't know how to put it, but I guess some sort of transformation into how they're going to generate their income taxes. As more businesses make a permanent decision to work remote, cities are going to lose a lot of income tax paid by people who work in their cities but live elsewhere.
Right.
And in our major cities around Ohio, that number is somewhere between 50 and 85% of the income tax is generated by people who don't live in those cities. So it's hard to predict right now where that's going to end up. I don't think that the cities are going to win in court if that's where it goes, because it's going to be hard pressed to get somebody to pay taxes to a jurisdiction that they've never entered and that they don't vote in.
Right.
But I think at the same time, the townships where there is no income tax are going to feel a burden, because now all of a sudden those workers are using their services as opposed to the city services. So you might start to see some dialogue between cities and townships that you didn't see before. And that could result in joint economic development districts or other shared services kinds of things, so that there's some sort of happy medium there. But I think we're way early in knowing just exactly where that's going to go.
It's an interesting topic. It really is. This seems like a good point to bring Missy Russo into the conversation. We're discussing workers and the issues they're facing. And Mercy Health Physicians is a physician-led group practice of 1,300 employed providers, including primary care physicians, advanced care providers, and specialists. So Missy has kind of a unique view, both as part of the Valley's biggest medical provider and as chief operating officer for this group. Missy, what are the misconceptions about the impact of COVID-19 on organizations such as yours, such as Mercy Health Physicians?
Thank you, Mark. So I think some of the, we didn't have the negative impact of, the COVID pandemic. Originally, we had change. So we had a lot of change to how we delivered care to our patients. So we had to make some shifts, and our patients, our providers, and our staff were agile. We had to close some practices and move people around, but we were doing it to meet patients where they needed care. So instead of coming into the practice, we would have virtual visits with them. So going from day-to-day operations in the practices, we were doing, video visits with our patients, but we were meeting them and keeping them safe, allowing them to still receive the care they needed, but not to come into our practices. We also, opened flu clinics and, met those patients that were sick or needed our care to come into offices where they could receive that care. We were fortunate that our supply chain was prepared for this, and we had the PPE that we needed to protect our patients and our staff and our providers, so that those patients could receive that care and feel safe about coming into our practices.
And pretty much doing it on the fly, like
yes, absolutely.
Your organization, like no one had advanced warning, so setting things like telehealth up and everything was done on the fly. Were there any lessons learned from that experience?
Yes. So we had virtual health previously, but of course, it ramped up, 2,000% once,
right.
We entered this, and we also had to open those flu clinics on the fly. So once, they started to shut things down, and we needed to get those patients care, we needed to reorganize our primary care offices and have offices that saw those flu patients and patients that could still come into practices that were, not patients that had those symptoms. So, if you needed to come in for your diabetic checks or your hypertension checks, you still had that opportunity. And you could also do virtual visits. If you felt comfortable, you can still do virtual visits. So we still have providers and patients that still want that. And we continue to provide that service. So it's meeting those patients where they need service at this time.
And I imagine that was sort of a big, evolution for your patient care. So that kind of made me think about, all right, over the past 14 months, if you're sort of assessing, from then to now, how has your physician group been impacted, both from a patient perspective and then from a doctor perspective?
I think in the beginning, patients were hesitant. They were concerned about, going anywhere. So, we did see that drop in patients coming into the office. But like I said, we met them by doing the virtual visits. We are essentially back to normal, I guess, the new normal. So, we see patients in the practice. We wear PPE more than we did in the past.
Right.
And so we do see those changes, but anybody can come into our offices. We allow that to happen. We do the social distance. We've moved waiting room chairs around to allow for those differences. But back to normal, as normal is going to be, is where we're at today.
Well, so you actually jumped on my next question. I was going to ask you what the new normal looks like, because you gave me a really good answer. So looking then, Missy, if you were to sort of guess a year from right now, where do you see your group a year from now? How would it have evolved yet again in a year from now?
So we, as we shifted to vaccines, we opened vaccine sites, and we've given over 77,000 vaccines to the community and to our associates. So we see that being an everyday occurrence, just like the flu vaccine. So those will be in our primary care locations. Our primary care locations in our offices are able to do COVID testing. I think that'll be just like flu testing, just like strep test, that you'll be able to come into our practices and have that. So I think we'll see that going forward. And I think virtual visits will continue. I think patients, appreciate the fact that they don't have to leave their home, and can still meet with their provider and receive care when needed. So I think going forward, that's what we'll see.
It's a good question, and I'm going to turn now to Eric and Sidar. Same question to both of you, and we'll start with Eric. Where do you see your organization a year from now?
Well, I think certainly we see us being back in the business. We know that things will change. Whether the mask mandate stays intact, and but geez, oh Pete, a year from now, we certainly hope, our normal is, I don't know. I mean, I would like to say that it's going to change to, after the pandemic, but in reality, our normal is 100% capacity and,
right.
and, indoors. That's just a fact. It's just, I don't know how, there's a lot of that are in that same situation. Now, I mean, can we have hand washing stations? Can we do absolutely we will. But in 1 year from now, I certainly hope that the normal is back to business, as usual, with some, with precautions in place.
I think we're always going to I think everyone probably has that sense. We're always going to have some level. The flu cases in the past flu season was negligible because of social distance masking. I think we've learned a lot about life that probably will be hanging with us for a while longer, maybe for the duration. Who knows? Sidar, sort of the same question to you. Where do you see Cafe 422 a year from now?
Thank you. We all learned from the previous year. We learned a lot. CDC guidelines and how to be prepared and this kind of things when it comes in place. As we're in a new year right now, so it's business are picking up a little more. I think we'll pick up a little more because of people are tired of staying home and hoping to come out and spend time with their families and friends. And we see them, every week is getting a little better as we servicing our guests and properly and with the CDC guidelines and make sure everything is in place. We're hoping that as business picks up in that direction, restaurant businesses and our local businesses in the area, we're hoping that we can have more people in place, because that's our big challenge right now as moving forward, as business start picking up a little more. I'm not quite sure if that's going to stay that way or if it's going to be a little bit more, but at the same time, the people that have been working with us for over the years and years, I can see a little frustration in their faces too, because they're putting lots of long hours. And that's our big challenge right now. We're hoping that things will change very quick, and people that are able to work, they can able to go apply here or other places, that's in Valley, that we can able to hire more people so we can able to service our guests and timely, properly, with all the CDC guidelines to make sure that everybody's having a great time when they're going out for dinner, at least.
And I think as just a customer here speaking, the things we took for granted before, like, going to watch a concert at one of Eric's venues or having peppers and oil at Cafe 422. Just, I think there's so many of us who want that feeling of normalcy, and we can't wait for that to happen, because you miss it and you realize how much you took great things that happen around here for granted. Well, it's gotten to 2:30, and I thought we have an audience member question submitted, so let's go to that. I'm going to ask this to all, but I'm going to start with Guy. An audience member sent me this question. In recent months, I've been noting businesses where workers are wearing their masks on their chins or not even at all. I don't do business there at all. How can we emerge, your term, they said, when so many businesses are not taking this seriously? So, Guy, how would you answer a question like that?
My first reaction is I don't know about that last comment about not taking it seriously. I find myself lots of times forgetting to put my mask back up, and I think when I patronize a place of business and I'm not comfortable, or somebody I'm with is not comfortable with how the employee might be properly equipped, bring it up. Just ask the server at Cigar's restaurant, please, you might have forgotten when you went, somewhere outside for a break or something. Please put it back up. And sometimes it just slips down. So I just think that just remind people that you're more comfortable if they would just put it back up.
I flew over the weekend to see my mom in Florida for Mother's Day, and people getting into airports, whether it's federally mandated, you must wear a mask. A lot of people were enjoying not wearing their mask. But in planes, I have to tell you, and it might be sort of the future of folks like Eric, where they become sort of the mask police unless things change dramatically. But that I would not want to be a flight attendant watching those poor people as every person comes in the plane and then up and down the aisles reminding them of masks. It was, that's a huge job. And I think flight attendants had, rough jobs to begin with just in this flying era. But boy, this has made it, talk about the impact on our workers. Lord, that was, seems like just a messy way to conduct your business every day. Eric, what do you think about the notion that businesses are not taking this seriously?
Well, I don't, quite honestly, I don't agree with that. I think it's very difficult. I mean, to Guy's point, it's very difficult, to enforce some of this stuff. I mean, Sadar can make sure that people are wearing their mask when they come in, go into their table, but now they're going to get up and go to the bathroom, and and I think that people, I think it's the people. A lot of people out there don't care more than the business owners. Now, maybe that's easy for me to say because I'm a business owner, but I think it's very, very difficult. I know we've done some Phantoms games and we've kicked people out, for not wearing their masks. And how is that going to happen when we have a concert at the Cavelli Center for 6,000 people? It's extremely, extremely difficult to enforce. Last time I looked, you couldn't put somebody in jail for it. So, I'm just speaking honestly here that I don't know if it's so much the business owner. And I think a lot of people just aren't informed. I was on an airplane yesterday, and the guy next to me, I had the mask right here. The guy next to me had a mask on. I said, "How you doing?" He said, "Oh, I'm doing good. I'm doing good." Pulls his mask down to talk. And so I don't necessarily think it's fair to blame the business owners at all, all the time. Now, I'm sure that there are some that don't do it, and people, make their own decision whether they go back and patronize that or not.
Sadar, how about you, as a business owner, about the idea whether businesses are taking the whole mask and thing seriously? Well, how do you view that?
I feel the same way Eric said and Guy said too. The staff members are working very hard. As the weather's getting a little warm up too, they go back in the kitchen, back and forth. I mean, the staff members are been very grateful, actually. They've been following the guidelines and very much in that direction. I mean, if every once in a while it happens, I mean, I think, like we all forget things. Just let us know. We'll be more than happy. We're not giving your attitude. We're not going to tell you, whatever. We're just going to say, absolutely. Well, I'll be more than happy to remind one of my staff members to make sure they put them on. And that's what it's all about. I mean, this is not, it's very important. I mean, people are coming to restaurants and they want to feel comfortable. And we want to make sure that our staff members are doing the same thing. So I don't see very much, in that direction, but we're doing the best we can to make sure that our staff members, and including our guests, I feel comfortable coming into our restaurants.
And Missy, I have to imagine that in your business, employees take masking very seriously.
Yes, we do. But, I agree with the other panelists that, it's everyone's responsibility. So it's just reminding everybody that we have a responsibility to, protect our patients and to protect others. And, this is what we need to do. And I think, like they said, just reminding folks, it's not something they're doing on purpose necessarily. It's just might have been something that they just forgot.
Well, and I'm going to jump over the net. We have another audience question. It's really awesome, but maybe we'll come back to it because I see our time is going as quickly as I feared it would go. I want to discuss a little bit about, plans for 2021, 2022. And this is a question for all. And we'll start with Eric this time. At the start of the pandemic, about 15 months ago, there were all sorts of early anticipations when things would get back to normal. It ranged from Easter weekend back in 2020 to this past Christmas. And now President Biden is suggesting that the 4th of July could mark a new independent day if 70% of all Americans receive at least one dose of COVID-19 vaccine by then. That administration also says it's going to have 160 million adults fully vaccinated by then. If we were to achieve that goal, what would it mean to business plans? Eric, you go first. If we hit that goal, what would it mean to your business plans?
It would mean we'd get back in the business, and it would, I could tell you the shows that we have put on sale, at Packard, we have some shows on sale. At the amphitheater, we're getting ready to announce some other ones where we can do it with the restricted capacities. Have sold incredible. I mean, people out there there's a lot of people that are afraid and maybe do not want to, but there is a certain size of the population out there that want to go back and want to start coming to events. And so, I mean, it looks like, if we're allowed, we will get back into business full force, when that comes. I mean, our outlook is fantastic once we're allowed to be back in business. The thing about arts and entertainment that really has struck me, and the one thing I want to get across is that, when I talk to the restaurant owners, when I talk to the businesses downtown, I mean, they have been affected tremendously, and every one of them say, we can't wait till you get back in business. The thing about these facilities was always to be an economic driver, and we know what arts and entertainment does that. The average person that goes to an arts and entertainment event in the state of Ohio spends $37 outside of the venue, by going out to eat, by lodging, these type of things. And so, I'm hoping that we could get back into business to really go back and help all of our friends in downtown and throughout the community.
Yeah, because your business actually is one of those that has so many attachments to it. I mean, people go to a show, but they also have a drink. They also go to dinner. So the ripple effect of reopening, those venues is actually good for other people in the economy. So, Guy, if we hit 70% of Americans by 4th of July, what do you think that means for business plans for the rest of 2021?
I think a lot of people, in terms of all of 2021, cautiously plan not to have it happen that soon. So I think it's good news. But I also think that we have to be guarded. There are some residuals that will continue after we fully open. For one thing, the size of government has exploded in the past 14 months. And who knows what the long-term implications of that are. But right now we're feeling the pain of our businesses having to compete against government for workers because of the paying people to not go to work.
So what do your members on unemployment, what do your members tell you, Guy, are the biggest challenges they face in emerging right now?
Oh, it's a crisis point now for some of them to find workers, able-bodied workers. A lot of business aren't fully open right now simply because of that, not because of the COVID. Some of your restaurants that might be closed on certain days, it's sometimes because of the workers, not because of any COVID restriction or any residual from COVID. Our members are telling us repeatedly they would much prefer that government paid people to go to work rather than pay people to not go to work.
Yeah, one of the questions we have from a reader is, how can we emerge when so many people are refusing to work because they make more on unemployment? Sidar, I'm going to imagine you've run into this a little bit. What are your views on that?
We live in the greatest country on the earth. I mean, I came in this country with nothing. All I know is work. And when people don't go to work, I don't get it. So yes, I mean, instead of you just made a great suggestions. Instead of paying people staying home, let's pay the people to go to work. And what was wrong with that? Nothing wrong with that. And there's more money in their pockets. Or go to work and get you paid, and we'll give you maybe 50% more on your pay.
Right.
There's all kind of solutions out there, but I don't think is the right direction is paying people and staying home. We all have a family. I have two beautiful girls. They're 17 and 18 years old. I mean, they're helping me out right now. They're going to school because we are short staffed. And how I'm going to teach my kids staying home that I'm going to pay you or government's going to be taking care of you? I'm teaching them at a young age that you need to go to work. Eric made a great comment. I mean, entertainment part of it is very, very important for the restaurant business. When Packard Museum, when Youngstown, and people are going out for the live music, and we can see our restaurant reservations are coming left and right. So yes, as business in 2021 hopefully is pick up and go in the right direction, we're hoping the other elements of businesses to open up too, that we all can have a very safe and a great year in for the future.
By the same token, did a little research, and the largest segment of people who've remained out of work or lost their jobs are women. And one of the issues that are going on is that 50% of daycare centers in this country are still not reopened. And with schools on half the schedule or kind of a schedule, I think you have a lot of parents out there who don't know, if I go back to work, then who watches my kids? And if they're still at home doing school, I'm sort of trapped there. Guy, do you have a solution for that?
Yeah, that's another issue. I mean, it's not just paying people to stay home, but it's also, remote school hurts employers as well because you're losing employees that have to stay home with their kids. The lack of daycare, that's a major concern for our members because, again, their employees have to stay home with their kids. So all of this, it's not just magically saying 4th of July we're going to reopen, but it's reopening. It's getting people to feel comfortable. Just because the government says it's okay to reopen, there still might be a lot of people out there that aren't ready yet to get back into things full swing. There might be companies out there. We're hearing from some of the bigger corporations too that they're not going to, even if the government says reopen, they're not having their people come back to work in-house this year. So there's still a lot to work through here.
Eric, Missy, do either of you have a sort of an insight as to the employment factor here?
Well, in healthcare, we haven't seen the refusal to work. It's more, as it is across the United States, the nursing shortage, just due to the fact of the pandemic and what's going on with nurses not entering the workforce. So we're seeing more of that than a refusal to work in our industry.
How are you guys managing that? What innovations have you looked at?
Meeting with the schools, the different universities that have nursing students and having job fairs and reaching out to them, having them do their clinicals at our hospital, getting used to our system, knowing our system, knowing our managers, knowing our organization, I think has helped us to, continue to work on getting those numbers up.
That's great. Eric, any insight?
Yeah, I think it's interesting with the panel that you've put together because we're really in different spots, right? Us in the entertainment industry, again, we're the leading sector of unemployment in the state and really across the country. Right. So we haven't, where you have Sidar wanting to get back into business and needs employees to do so. we haven't felt any of that really help wanted. Maybe a little bit, but again, there's about 60% of our people laid off. Our average major event that we'll do, just say at the Covelli Center, we have up to 150 employees. A lot of people don't realize that, to pull that off. Our Y Live concert, as you know, picture back here, we canceled this year. We went on sale during the pandemic. We went on sale in the middle of March, right before everything shut down. And we were 75% sold, and people held on to their tickets. Wow. But that event right there, we employ about 450 people just to put that event on. So, we haven't had the pinch of not being able to find employees. I know it's coming. Listen to everybody on the panelists and stuff. I know that's coming, but we haven't felt that yet because, doing such minimum capacity, we obviously. We're doing smaller shows that, we don't need many stagehands. We don't need as much security, ushers, ticket takers, and things like that. And then really on our full-time status, we're at 50% right now.
Right.
And really can't add those full-time employees back until such time that we're able to open up at a much higher capacity.
And you're right, and I love this this panel because I think we're really getting sort of a 360 view of what some of these emergence and reemergence issues are. And looking at the clock on my computer, we are winding down, but I have one. Well, I'm going to go through one more quick lightning round with all of you. And thank you again. I mean, we're having a good audience. We're getting questions here, and it's really nice to have such a smart group here to kind of tackle some of the issues that people are talking about. So one quick question, we'll go around the horn one more time, and we'll start with Guy. If you had to describe a scenario that you felt best encapsulated the total reemergence of business in the next year, what would that look like, Guy?
I think it would look like me and my friends very comfortably going to a great live show at the Covelli Center and having a nice dinner at Cafe 422. And being able to do that just over and over again, that's the ideal scenario. People back to work, and unfortunately, it's not going to be 100% like it used to be, but as close to that as possible. That's where my mind is looking at.
Eric, how about you?
Same thing. We're looking at, being able to get back into business, and bring all of our employees back and entertain people, But the thing that we do is that, I've always said that we make memories, and I don't know that there's, entertainment really does so much in a way that people don't even realize sometimes. You talk about depression, you hear all these things that are going on of people being cooped up and not being able to go out and do their things. On the health side of things, I believe that creating memories is a great way to heal. And so hopefully we'll be able to do that again real soon. And that's the only way that I myself and everybody in our company and everybody in our industry sees this, getting back to normal. Has given us the opportunity and letting us do it and letting people make their own decisions whether or not they feel comfortable in doing it or not.
Boy, I'd love to make some new memories. That's a wonderful way of putting it. Hey, Sidar, what would the scenario for the total reemergence of your business? What do you imagine that's going to look like?
I feel the same way. We want to just go back to normal, finding the right people for our business and just taking care of our business and taking care of people that come into our restaurants and just do the best we can and visit our families that we used to and see all the similar faces that we see our restaurants and all the time that we haven't seen them and we'd like to see them back again.
The regulars.
So that's our regulars. Our restaurants business is all about regulars. So, sometimes when you don't see them, you feel like, you don't see your family.
Right.
So we're looking forward to, hopefully things will go back to normal and for everybody. So.
Missy, I'm going to give the last word to you.
Thank you. So I think, we want to get back to just continuing that expansion of care, access to care, and thinking more strategically and innovatively, for our patients and our community. So I think that's what we're looking forward to. We've been doing that over the last few months, but just continuing to enhance that.
Well, thank you, and really thank all of you for joining us today. Both a wonderful panel. It's kind of an all-star panel of Valley folks, and we appreciate them joining us. We appreciate folks in our audience joining us. And remember, you can watch replays of this on our YouTube page, on our Facebook page, and it'll be full coverage by Jess Harden tomorrow. These discussions are part of the Mahoney Matters ongoing commitment to bring people together, talk about the issues that matter most in the Mahoning Valley. And we can't do that without the support of partners like Tema Roofing Services. We want to thank them again for supporting today's event, and we can't do it without you. If this mission to keep our community connected and informed matters to you, again, we ask consider making a one-time or monthly donation in support of quality community journalism that you find at Mahoney Matters. And we deliver it every day at MahoneyMatters.com. We also want to thank, once again, the panelists, Guy Coviello, Eric Ryan, Sardar Dede, Missy Russo, for a great conversation. I certainly learned a lot, and I hope all of you did as well. Remember, you can watch the full recording on our pages, and we really appreciate you joining us today. Have a great rest of your Wednesday, and let's make today count. Thanks again.